everyone, my name is Osha McKay, and today we're going to be talking about the modern treatments of post-traumatic stress disorder. Meet Jane. Jane suffers from post-traumatic stress disorder.
So the question becomes, what is PTSD? According to the authors of our textbook, PTSD is an emotional disorder that can occur as a result of living through a traumatic event. These traumatic events can include things like war, natural disasters, death of a loved one, or physical or sexual assault. According to the DSM-5, there are 8 different criterion that are followed in the diagnosis of PTSD. These are exposure to a traumatic event, intrusion symptoms, avoidance symptoms, change in cognition, altered arousal or mood, duration of disturbance, functional impairments, and exclusion of other diagnoses. When Jane found out that there are tons of researchers around the world working hard to find effective treatment methods for PTSD, she began to feel understood. So Jane gets started researching right away. So today we're going to be talking about 5 different studies that have been conducted referencing 5 various types of treatment methods for post-traumatic stress disorder. A study on alert hypnosis was done by Eads and Work in 2015.
Alert hypnosis is a method of hypnosis in which involves being in a state of attentiveness versus relaxation. Through the analysis of 3 case studies of PTSD veterans, it suggested that alert hypnosis can make major positive impact upon those suffering from PTSD in ways such as improving their communication skills and decreasing their anxiety.
A meta-analysis on cognitive behavioral therapy, or CBT, was done in 2018 by Kairouz et al. In the meta-analysis, PTSD in Arab adults was examined. The main finding was that CBT is a potential encourager to Arab adults and prospectively other culturally and linguistically diverse populations in seeking other mental health assistance. Therefore, cognitive behavioral therapy was proved to be an effective treatment. Kangna, Fauziart, Girard, and Manellas in 2018 take a new route to therapy by focusing on action-centered exposure therapy in the form of virtual reality, otherwise known as VR. In the form of an experiment, the researchers assessed the effects of ACET VR on subjects with PTSD. This allows the patients to face their roots of distress and be in touch with their feelings. Although more studies on this need to be done because it's so new, it was found that the utilization of VR in the treatment of PTSD is highly effective. A study was conducted by Peterson et al. In 2018, investigating the effects of intensive prolonged exposure therapy on patients with post-traumatic stress disorder. This study used daily treatments of various types of prolonged exposure therapy on active military members and veterans that were recruited. It was found that treating combat-related PTSD in remission with a random clinical trial using an intensive prolonged form of ACET, that PTSD symptoms are reduced for over 50% of patients that actively solicit treatment. What's also interesting is that the American Psychological Association reports that exposure therapy is often effective for other disorders as well, such as panic, social anxiety, OCD, or generalized anxiety, because it decreases elements of fear or distress in the patient when they're approached by that stimuli.
The final study on antidepressants in the form of paroxetine was conducted by Zhu et al. In 2015.
The study aimed to evaluate paroxetine's treatment efficacy for PTSD through the use of resting state functional MRI scanning. By monitoring the spontaneous neuronal activity in the brain before and after a 3-month paroxetine treatment, the individuals conducting the study hoped to see improvement. The final results display evidence that treating chronic PTSD with paroxetine on a short-term basis could assist in the improvement of clinical symptoms, along with regulating spontaneous brain activity in areas within the precuneus region and the orbitofrontal cortex. Now that Jane has finished her research, she feels ecstatic that there are so many new treatment options that she can look into. And that brings us to the end of the video. Thank you all so much for watching, and have a happy holidays.